Do you think you're pregnant? Are you wondering if that little pregnancy stick at home can really give you a clear answer about whether or not you're pregnant? Well, before you grab a pregnancy test, let's dive into how accurate they truly are, because the timing, technique, as well as the type of test that you use can really make all the difference in terms of accuracy. So let's break it down. I'm Dr. Pinnock, and I'm a board-certified OBGYN and high-risk pregnancy doctor, passionate about helping you to have a healthy and enjoyable pregnancy. So if you enjoy watching these videos and the content that I produce, don't forget to subscribe to my channel so you don't miss any new videos that come out. So let's dive right in. So whether your pregnancy was planned or maybe it was a bit of a surprise, if you're suspecting that you're pregnant, the first thing that you're probably going to do is grab a home pregnancy test. But really, how accurate are these tests and what factors could potentially lead to having an incorrect results? Well, we're going to talk about that today. So there are two main types of pregnancy tests that you should know about. The home pregnancy test that checks your urine, as well as the blood test that's done in a lab. Both of these tests detect or pick up a hormone called beta-HCG. And beta-HCG is a specific hormone related to pregnancy. This is the hormone that gets released into your bloodstream after that sperm and that egg meets and they become fertilized and they combine and really land into the uterus in a process called implantation. So once that fertilized egg implants into the uterus, your body then begins to make this beta-HCG hormone. And the next steps after you suspect that you're pregnant are really critical in terms of determining how accurate your results are going to be. Now, when we think about the accuracy of your pregnancy test, it can depend on a few different things. The first is timing. When we think about timing, we're really talking about your menstrual cycles. So specifically, how soon are you testing after that fertilized egg was implanted? Or how soon are you testing after that sperm and egg meet and landed in the uterus and started producing that beta-HCG hormone? Because that timing is so important, it's really, really critical that you're able to track your menstrual cycle so you can understand when you're ovulating or releasing that egg every month. Usually ovulation for many women happen on around day 14 of your menstrual cycle, but it can definitely vary. But understanding when you ovulated and when that fertilization may have occurred can help you to time when it's best to take that home pregnancy test. Because if you test too soon, then the levels of the beta-HCG hormone may not be high enough to be detected on that home test. The second component that determines how accurate a pregnancy test is something called the sensitivity of the test that you're using, or how good the test is at detecting your pregnancy. Not all pregnancy tests are created equally. Some pregnancy tests are better at detecting very low levels of beta-HCG than others, and we'll get into that next. Now, when we think about the different pregnancy tests that we have the blood test and we have the urine test, and we're just gonna briefly talk about the differences in the accuracy between the two. First, we'll talk about the home pregnancy tests. So these home pregnancy tests are designed to detect the HCG hormone in your urine, and most of these tests claim to be over 99% accurate when you use them on or after the first day of missing your period. But really, this accuracy can vary, and it depends on how sensitive or how accurate that test is at detecting those low levels of beta-HCG. So for example, the first response early result test is considered to be one of the most sensitive tests or accurate tests because it detects HCG levels as low as 6.5 milli-international units per milliliter, which essentially allows it to identify about 97% of pregnancies from the first day you miss your period. Now, I'd say that's pretty accurate. Other brands like Clear Blue or EPT can detect HCG at slightly higher levels, around 20 to 25 milli-international units per milliliter. So they're still pretty accurate. They're just a little bit less sensitive in the earlier days of pregnancy. And so you should really just think about which test you're using, depending on how early from that fertilization event that you're testing. Home pregnancy tests are quite popular because they're super easy to use. But keep in mind, most home pregnancy tests work best when you use them after you miss your period, not necessarily right after you have intercourse or right after when you suspect fertilization. they're usually most accurate after you miss your period. With that being said, they're really highly accurate when the result is positive, but they can show a false negative if the HCG levels are too low to pick up, especially if you test too early. So by false negative, I mean you may be pregnant, but the test is saying you're not pregnant. This is actually why many home pregnancy tests actually includes 2 strips. So you can retest after a few days just in case if that first test was negative, to allow your body some more time to perhaps release more or a higher level of that beta HCG hormone, so the test is able to detect it better. Now, let's talk about the blood tests. Blood tests, on the other hand, are a lot more accurate, and this is because they actually measure the exact amount of beta HCG level in your blood. There is a small caveat to that. There are actually 2 types of blood tests: a qualitative blood test, which is just sort of a yes or no, and a quantitative blood test, which gives us an exact number. So for the qualitative test, it simply confirms whether that HCG hormone is present or not present, kind of similar to that urine pregnancy test at home, but with much higher accuracy. Whereas the quantitative test, or the numbers, gives us exactly what level of beta HCG hormone is in the blood, and it can detect really, really low levels, often as low as 1 to 2 international units per milliliter, so extremely low levels. This makes the blood test, especially the quantitative blood test, particularly reliable for early detection, so really, really, early pregnancy, or in cases where there's some uncertainty about the urine results and you're just, really looking to know whether or not you're pregnant, then I'd say the blood test is an excellent option. The blood test can actually detect pregnancy as early as 6 to 8 days after ovulation. So after that, egg gets released and gets combined with the sperm, it can detect pregnancy as early as a week after that. So that's way before you even miss your period, but the urine tests are generally recommended to be used after you miss your period, just to make sure that they're the most accurate that they can be. So while, blood tests are really accurate, they do require generally a visit to a healthcare provider. So whether that's a doctor's office or a lab, you do have to go in to get that blood test, which isn't always convenient for everyone. And the home tests are a lot more accessible for many women and more affordable. But if you want absolute certainty, especially if your test is showing negative, but you may be feeling some signs of pregnancy or symptoms of pregnancy, then using the blood test is definitely going to be, your best bet, or at least the best next step to try to understand better what's going on in terms of a pregnancy. So are pregnancy tests accurate? I'd say for sure most of the time. In terms of home urine tests, most of those tests, if they have a positive result, they're likely correct. The main result is generally having a false negative from doing those tests too early. But I will say there are some rare cases where you can actually have a false positive on a home pregnancy test that I did want to briefly touch on. Home pregnancy tests can actually have false positive results for a number of different reasons. One of them being having a chemical pregnancy. So essentially, this is a very, very early pregnancy that happens when the sperm and egg combine, but they still got far enough along in the process to produce some HCG hormone to be picked up by that home pregnancy test. But, the pregnancy stopped developing. And so this can actually cause a false positive result. So you can have a positive urine pregnancy test, even though the pregnancy is no longer there or no longer viable. Another reason why you can have a false positive result on a home pregnancy test is because of something called evaporation lines. So essentially, if you read the test after the recommended time window on the instruction panel, there can be an evaporation line that can come up where the positive line would be, and that can lead you to think that it's a positive test, but it really isn't. You just kind of read it outside of the window when it's recommended to be read. Another reason that could potentially cause a false positive home pregnancy test is if you've been recently pregnant, maybe you've had a full-term delivery or a miscarriage, you can have leftover beta HCG hormone that just takes time for your body to sort of remove, that could potentially cause a false positive urine test if you do take a pregnancy test too soon after your previous pregnancy. A few additional things to consider that can cause a false positive pregnancy test at home are certain medications, particularly fertility medications. Some treatments actually use the hormone HCG, often known as a trigger shot. That can also cause elevated levels and lead to false positives. And lastly, some rare medical conditions such as an abnormal pregnancy or something called a molar pregnancy, certain cysts, and rarely certain cancers can actually cause a false positive home pregnancy test. Oftentimes, if your pregnancy test is positive, it's generally because you're pregnant, and it's not generally because of a false positive reason, as I just mentioned. As I did mention before, I'd say the main concern with urine pregnancy tests is around false negatives, and this can also happen for a few reasons. As I mentioned, if you take the pregnancy test too soon, especially if you have irregular periods, I recommend waiting at least until you miss your period, or at least 2 weeks after you have intercourse before testing. And then I'd say another reason for a false negative result is user error. So that's right, I'm talking about you. So remember to always read the instructions carefully on your test. It can be really easy to misinterpret those lines when you're feeling anxious. So if you want to avoid any confusion, maybe consider getting like a digital test that clearly says yes or no, so there's no sort of misunderstanding with, what means pregnant and not pregnant, and take all the guesswork out of, that part of the test. But I hope this clears up some of the confusion around pregnancy tests. Remember, if you're unsure, don't hesitate to reach out to a healthcare provider to just double check about the status of your pregnancy. And if you are pregnant and would like to find out more about what not to eat in pregnancy, take a look at my checklist about 10 foods to avoid in pregnancy at badpregnancyfoods.com, or find it in the link below. As always, if you found this video helpful, don't forget to subscribe to my channel, give us a thumbs up, and leave some comments down below with what you'd like to hear me cover next. All right, I'll see you on the next one.